Right, so welcome back guys. Here in this particular session we'll be talking about macronutrients, right? So we are in the nutrition playlist, right? In the last section only we have talked about the energy requirements, right? And we have talked about the macronutrients basically. And now in this particular session we will be talking about the micronutrients. So let's start with the micronutrients over here. So let me just correct it. Now we shall be talking about the micronutrients. Okay, micronutrients. Fine. So if you talk about the micronutrients, right, we shall talk about some of the vitamin deficiencies, we shall be talking about the mineral deficiencies, right, we will be talking about the iodine, we will be talking about the fluorine, zinc and all of these things, right. So let's begin with that. So if you talk about micronutrients, right, first of all we should know that the deficiency of micronutrients, right, deficiency of micronutrients is termed as hunger index. First point, right? Most common cause, if you talk about most common cause of these micronutrients is the iron deficiency. Yes, very common, that is the iron deficiency. If you specifically talk about which vitamin deficiency, if they will specifically talk about that which vitamin deficiency is causing the micronutrient deficiency, then your answer in that case will be the vitamin A deficiency or the retinol deficiency, right? So vitamin A deficiency. Then if you talk about vitamin A, it's a very important topic. So now let me talk about the vitamin A. Vitamin A is known by the different names. For example, you must have known that with the name of retinol as well. Now vitamin A, if we talk about, the richest source of vitamin A is the halibut fish. The richest source of the, so what is the richest source? Very commonly asked MCQ. Richest source of vitamin A, that is the halibut fish. Okay, very important MCQ. Second point, that the dose which we are giving, for example, some patient is having vitamin A deficiency, the child is having vitamin A deficiency, right? So vitamin A deficiency, to actually reverse that, or to what we can do for the treatment part, so we are actually, for the prophylaxis purpose also and for the treatment purpose also, we are actually giving the vitamin A doses, right? And these are the oral doses, by the way, and basically we are giving in total of 17 lakhs international unit of vitamin A. So let me talk about that. So total dose, if we talk about, right, so total dose, how much dose we are giving? We are giving the 17 lakhs international unit, 17 lakhs international unit vitamin A, okay, that we are giving. Okay, it is the oral, it's not the injectable form, it is the oral form, right? How we are giving it is the next MCQ. We are giving it, 100,000 international unit, 100,000 international unit will be given with measles vaccine, will be given with measles vaccine, okay, and we will be giving it at 9 months. We will be giving it at 9 months, okay. Again, we will be giving 100,000 international unit, okay. This time not 100,000, we will be giving it at 200,000, okay. So we will be giving 200,000 international unit. And why will be giving 2,000 international unit? Okay, at what time will be giving 2 lakh international units? Here we will be giving it along with the DPT booster vaccine, okay, and that will be given at around 15 to 18 months. So this will be given with DPT vaccine, DPT vaccine at 15 to 18 months, right? Then again we will be giving the 2 lakh international units. Again we will be giving the 2 lakh international units, okay, and this will be given this time, right, every 6 months. This will be given every 6 months till 5 years of age, right, till 5 years of age. And if we talk about 1 lakh international unit, it is actually equal to the 1 ml, right? So we'll be giving first of all 1 ml, then 2 ml, 2 ml, like that, okay. And we should know, so I should mention over here that 1 lakh international unit is equal to 1 ml, okay, that should be known to you. One more point over here, that if we talk about vitamin A supplementation for the Indian children, okay, that is very important for the Indian children, they are saying that if the age is 6 to 11 months, or if the age is 6 to 12 months, okay, you can remember like that, then in those cases we are giving the 1 lakh international unit, and it is equal to how much ml? It is equal to 1 ml, right? And it is given once. If you talk about the 12 months to 5 years, 12 months to 5 years, then we are giving just double of that, that is a 2 lakh international unit, that is the 2 ml, okay, and it is given every 6 months. Okay, so that is very important to remember for us, right? Once we are knowing with that, so 6 months to 11 months, 1 lakh international unit once given, and we are giving 2 lakh international units for the 6 months to 5 years every 6 monthly. Okay, once we are clear with that, now, so guys, if we talk about the vitamin A deficiency, guys, according to the WHO, they have classified this vitamin A deficiency, right, which is causing the eyes problem. We know that very commonly the eyes might be affected due to the vitamin A deficiency. So WHO has been classified, right, the eye lesions, the eye ulcers, eye problems according to the WHO. We should be knowing this because this classification has been asked in the MCQs multiple times, right? In the FMGE, basically they have asked it multiple times. So over here we should know this classification from the WHO. So WHO says that, right, in the very first one there is a XN. XN means N for night blindness. So over here XN is the stage 1, that is a night blindness over here. In the second one we are talking about the X1A. X1A is talking about the conjunctival dryness, that is a conjunctival xerosis. Xerosis means dryness. So dry conjunctiva will be seen over there in the X1A stage. X1B is talking about the Bitot spots. Okay, X1B is talking about the Bitot spot, and Bitot spot is actually seen in the eye. It is one of the spot over there, right? So in the next section I will be showing you the image as well. So basically the Bitot spot, right, there is a spot in the sclera region, and that is the specifically that is the Bitot spot seen in the X1B, and that is reversible actually if you are giving the vitamin A supplementation at the right time. Okay, and this might be reversible in 4 to 6 weeks, okay, or 2 to 3 weeks. X2 is the corneal xerosis. Now the main point over here which you need to remember is that conjunctival xerosis is happening in which stage, and the corneal xerosis. Conjunctiva and cornea is different, guys. In the conjunctival xerosis we are seeing that was the X1A stage, and in the X2 we are talking about the corneal xerosis. So that is very important differentiating feature. X3A, if we talk about, that is a keratomalacia, right, or corneal ulcer can be seen, but here less than 1/3 of the cornea will be involved over here. Less than 1/3 will be involved in the X3A. More than 1/3 corneal involvement can be seen. More than 1/3 can be seen in the X3B stage. In the X3B stage we are talking about the keratomalacia, that we are talking in the X3A only. But how you can differentiate between X3A and X3B? In the X3A basically we are talking about less than 1/3 corneal involvement, and in the X3B stage we are talking about the corneal involvement, that will be more than 1/3 area, right? XSS means there is scar, so corneal scar will be seen due to the dryness of the eye. So there is a due to the xerophthalmia, we will be seeing that xerophthalmia scar, this is the other name of that, and xerophthalmia fundus, that will be the XF stage, that will be the last stage over there, right? As the stages will be going on in the particular eye, right, the prognosis will be going poorer and poorer, right? Prognosis will also be becoming poorer only, right? And there is one more criteria over here which we need to understand, WHO criteria for a public health problem for the xerophthalmia. So there we have talked about different stages of the xerophthalmia, right? Xerophthalmia is happening due to the vitamin A deficiency. Now basically at what point of stage, at what point of time we'll be saying that this is the public health problem. So for the different stages we are having different criteria, right? For an example, for the night blindness, they are saying if it is more than 1%, then we'll be saying that it is a public health problem, right? And if it is if the Bitot spots are seen more than 0.5% of the population, then we'll be saying it is a public health problem. If you talk about the corneal xerosis or the ulceration or the keratomalacia, right, which we are talking about in the X3 stage, and right, X3A, X3B, and the corneal xerosis was the X2 stage. So in those cases we are talking about if the population more than 0.01% of the population, okay, more than 0.01% of the population will be suffering, then basically we'll be saying that this is the public health problem, right? If more than 0.05, this was the MCQ which has been asked already. So corneal scar they had asked you. Corneal scar they had asked us basically that it is actually seen in, if it is more than 0.05% of population will be suffering from that, then it will be the corneal, it will be the public health problem, right? And if you talk about the plasma retinol, right, if it is less than 0.35, right, micromole per liter, then it is more than 5%. But basically at least you should remember till here, in this particular table, okay? Now once we have talked about that, we shall talk about several kind of vitamin deficiencies, right? For an example, vitamin A, if you talk about, and what is the function, what are the sources also, let us talk about that as well. For example, vitamin A, guys. Vitamin A, we know that we have already talked about that. Okay, if you talk about the sources, we know that it could be the vegetables, different kinds of vegetables, green vegetables, broccoli, spinach, and all of these things, right? Carrots and all, right? And if you talk about the non-veg, okay, that is also rich in vitamin A. If you talk about the liver, if you talk about the fish, kidney, and the dairy products, right? For an example, yogurt, eggs, right? These are the quite rich sources of the vitamin A. So vitamin A is found in the wide range of food products, right? And if you talk about what is the function of it, it is helping us in, providing the immunity, increasing our immunity. It is very important for the vision. That's why we are seeing that xerophthalmia might be happening, and according to the WHO, we have seen different stages of xerophthalmia, right? Remember, we have seen the different stages. So these are the stages of what xerophthalmia, right? So we have seen different stages, okay? And these are very important, guys. Okay, this is something which you can't forget. This is something which you can't go to the exam without reading this, right? Okay, now if you talk about vitamin D, it is very important for the bones, right? So it is actually helping us absorbing calcium and keeping bones healthy, right? And it is actually, what are the sources? Sources also we should know, that is the sunlight. This is the natural source of the vitamin D, right? Then fish, liver oil, milk, fortified margarine, eggs or liver. Basically, you should remember eggs and the milk, basically they are very rich in the vitamin D, and natural source is the sunlight. Then if you talk about the vitamin E, basically it is helping us in maintaining the cell structure and the integrity of the cell, basically, and it is protecting the cell membranes, and it is protecting the cell to undergo lysis, right? So basically it is protecting the cell membrane. And what are the products which we need to remember? That is sources. So eggs might be there, peanut might be there, right? Different kind of cereals, soya beans and groundnuts. Okay, these are the richest sources of the vitamin E. If you talk about the vitamin K, very well we are knowing that they are helping us in the blood clotting, right? And various kind of vitamins, this vitamin K can be present in various kind of vegetables. For an example, spinach can be there, broccoli can be there, right? And in the non-veg products, we are talking about the fish, eggs, liver, milk, meat, and all of these things, right? Okay. If you talk about the B complex vitamins, B group vitamins, they are actually talking about the skin health and the eyes health and the nervous system, right? So basically these are because we know that, for example, vitamin B12 deficiency, if we talk about, that can cause the neurological complications, right? So we don't want that. So B complex is very important for us, and B complex are having important part in the immunity also. So we are actually prescribing the vitamin B complex, right, for gaining the immunity from some kind of, whenever the person is recovering from some kind of disease. So what are the sources, guys? Sources will be usually for the vitamin B12. If I talk about why I'm talking about vitamin B12 much, because very commonly it is tested, this particular vitamin. So vitamin B12, if you talk about, you can't get it from the plant sources. So the people who are actually vegetarian, they have to take some kind of supplements from outside. Otherwise, it is rich in the non-veg kind of food, right? And other kind of vitamin B complex might be present in the green vegetables and the vegetarian food. For example, vitamin B9. Usually it is found in the vegetarian products, right? For an example, green vegetables or the fruits and all of these things, right? So here we can see that fresh fruit can be there, milk, meat can be there, right? Then beans, peas, eggs. Okay, so all of these things are the products where we can find the different kind of vitamin B over there, right? Then we are having the vitamin C. Vitamin C, we know that it is very important for the healing purpose, right? Healing purpose, and it is very important for the immunity purpose. We saw that in the COVID-19 era, we were seeing that many health clinicians were actually prescribing the vitamin C, right? Why they were prescribing the vitamin C? Because it is having a very important role in the immunity. That's why they were prescribing it. So vitamin C is, guys, very important in the immunity. It is helping us in fighting of the infections also, right? So it is a very important part of the vitamin C, right? If you talk about what is the richest source of the vitamin C, guys, the richest source of vitamin C. So richest source of vitamin C is the Indian gooseberry. Indian gooseberry is the richest source of vitamin C, that is commonly called as amla in Hindi, right? So this is the richest source over here, right? So richest source of vitamin C, that is your Indian gooseberry. Okay, and with that we know that citrus fruits, it is very rich in citrus fruits are very rich over there. For example, amla, right? This is the richest source. Then we are having the grapes, we are having the oranges, right? These are very rich. Oranges, lemons, right? Tomatoes, these are very rich sources of the vitamin C over there, right? If you talk about the folic acid, that is the vitamin B9, and we are seeing that it is seen in the vegetarian food products. For example, vegetables over there, green vegetables, spinach, right? Broccoli and all of these things. Lettuce can be there, right? So these are very rich in those products, right? Oranges can be there, beans can be there, peas can be there. So green vegetable over there, they are the richest sources of the vitamin B9, and we know that it is what it is doing basically. It is protecting us or protecting the babies basically, from getting the neural tube defects, because vitamin B9 deficiency very commonly it can cause the neural tube defects in the babies and the children's, right? So usually the mothers, we are giving the iron tablets, with that we are giving the folic acid supplementation as well. Why we are giving that? Because we want to avoid the neural tube defects, obviously, right? Okay, then we are talking about the iron. Iron is actually rich in many kind of products, for example liver, meat, right, and the beans, millets, right, eggs over there, dark greeny leafy vegetables, right? These are the products where we can find the iron. And what it is doing basically, it is helping us in making the red blood cell. It is a very important part, right? Iron deficiency anemia, guys, it is very common in the Indian females. Basically 98% of the Indian females are actually having the iron deficiency anemia. Every pregnant female will be the iron deficient, right? And we are giving the iron supplements, right? It doesn't matter about the it is not related to the socio-economic status. If you talk about the pregnant ladies, every pregnant female is iron deficient, right? And they will be iron deficient because the iron which is present in the body, it will not be able to fulfill the demands of baby and the mother as well. So that's why we are giving the exogenous sources of iron basically. So with the iron supplements, we are also giving the vitamin B9, that is the folic acid, to prevent the neural tube defects in the baby, right? Okay. Now, if you talk about the calcium, right? Calcium is making the bones stronger, guys. We know that in the bones and the teeth, we are having the calcium over there, right? And if the calcium deficiency will be there, the bones will become weaker. That is happening in the elderly age group people, right? Where we are seeing the osteoporosis in the patient very commonly. So over here, it is present in the milk, dairy products over there. And we are having milk, cheese, right? This is also present in the green leafy vegetables and all. These could be the sources. So we have talked about different kind of sources as far as vitamins are concerned. We have talked about the functions. What are the functions of this important kind of proteins, kind of vitamins, sorry, right? So these kind of differences we should know actually between these kind of vitamins, right? So sources and what are the functions, they should be known to us. Now let's come over to the deficiencies part. So deficiency, if we talk about, guys, let me take the vitamin A over here. Vitamin A, we know that it is causing the night blindness, right? Xerophthalmia. We have talked about the the classification part as well according to WHO, right? And we have talked about the WHO classification for the public health problem as well, right? As far as xerophthalmia is concerned, then it can be increasing the risk of mortality in the children and the pregnant woman if very low level of vitamin A will be seen, right? Okay, if you talk about the vitamin B9 folate, right, it is not the B6, it is actually the vitamin B9. Okay, it is wrong over here, so it is vitamin B9. So if you talk about the vitamin B9, then it is the folate or folic acid. So it might be causing the deficiency of it, might be causing the megaloblastic anemia, it might be causing the neural tube defect, as I already told you, right? So birth defect, neural tube defect basically. So please remember the NTD, that is a neural tube defect, right? The heart disease, stroke and all of these things might be there, but these are the main defects. So right, so I'm just highlighting that is a neural tube defect over there. Okay, NTD, that is a very important thing which you need to remember. Megaloblastic anemia, that can also be happening, right? If you talk about the vitamin B12, guys, again megaloblastic anemia might be seen over there with the B12 as well, right? So vitamin B12, it is also called as the cobalamin or the cyanocobalamin, right? Cobalamin is actually absorbed in which part of small intestine, guys? Yes, that is coming from the pathology side, right, or the physiology, right? It is coming, yes, it is getting absorbed. Vitamin B12 is getting absorbed in the ileum part, and vitamin B9 is getting absorbed in the jejunum part, and vitamin and iron is getting absorbed in the duodenum, right? So these are very important 3 questions from the pathology as well. Okay, so vitamin B12, guys, it is causing the megaloblastic anemia, deficiency of it, right? And it is actually associated with the Helicobacter pylori induced gastric atrophy, because what happens is that this is actually related with the Castle intrinsic factor. Actually, for the vitamin B12 absorption, we need the intrinsic Castle factor, right? And if the intrinsic Castle factor is not there, intrinsic Castle factor is actually coming from the parietal cells in the stomach. So if the stomach is having atrophy is there, or surgeon might have removed it, let's say there was a history of stomach surgery, so in those kind of cases there might be the deficiency of Castle intrinsic factor. And if the Castle intrinsic factor will be deficient, then obviously it will be leading to the vitamin B12 deficiency, because vitamin B12 absorption is having a very important role for the intrinsic factor. So if the intrinsic factor is absent over there, or it is very low, then obviously B12 will not be able to absorb into the ileum part, right? So ileum part is the one which is the small intestine part where the vitamin B12 is getting absorbed, right? So I should be writing this thing over here, right? So I just write in the vitamin B1 section. So, but by the way, you know this, right, what I'm talking about, okay? And then if you talk about the vitamin B1, guys, vitamin B1 is actually the other name for the thiamine only. and the deficiency of it is causing the beriberi. It might be the dry beriberi, it might be the wet beriberi. If I'm talking about the wet beriberi, it is the cardiac abnormality which we are talking about, right? These things you must have heard about that in the medicine section, right, in the biochemistry as well. So beriberi over here, it is causing the cardiac and the neurologic. In the if as far as neurological symptoms are concerned, then it can be causing the Wernicke and the Korsakoff psychosis. Wernicke and the Korsakoff psychosis is a Korsakoff psychosis. Okay, so it can cause that. So alcoholic confusion can be there, confabulation can be there, and the paralysis might be seen over there. Now vitamin B2. Vitamin B2 is another name for the riboflavin. You know, other name should also be known, guys. Vitamin A, retinol. Okay, other name must be known by you guys for these kind of vitamins. So vitamin B2, then it is actually riboflavin only, and the deficiency of it will be causing what? You know, impaired iron absorption, eye changes might be there, dermatitis might be there, and you know, there might be the chlosis. If you talk about the vitamin B2 deficiency, there might be the cuts in these areas, right? Cuts in these areas, you know, regarding the para-oral region, there might be the cuts here and there. So that might be the deficiency of vitamin B2 again. Niacin deficiency, we have already talked about in the previous section, guys. Vitamin B3 deficiency or the niacin deficiency, it is causing the pellagra. And I told you that castle necklace might be seen over there. And we have talked about the triad as well over there also. So here we are talking about pellagra might be seen, dermatitis, diarrhea, dementia, and death, right? This we have talked about. Death is rare actually in these cases, but in some severe cases, it might lead to the death as well. Vitamin B6 deficiency, guys, if we talk about vitamin B3, right? So in the vitamin B3 deficiency, we are talking about dermatitis. We might talk about some kind of neurological dissociations might be seen, neurological dysfunctions might be seen, right? With that, conversions can be there, anemia might be seen in the patient, right? These are some of the symptoms which can be seen. And increased level of plasma homocysteine, you know, this is very important for the vitamin B6 deficiency, right? So once we have talked about the iron, guys, now let's talk about the next one, that is the iodine, right? Now let's talk about the iodine. Okay, if we talk about iodine, right, this is basically you know, we can find it in the soil, right? And we are using the iodine addition. We are doing the iodine addition with the salt also. So okay, that I have discussed earlier as well in the last section. So iodine over here, if we talk about, we can find it in the soil, we can find it in the sea, right? Basically the deep sea fishes, right, they might be rich in the iodine also, right? Okay, so we are having some iodine rich foods over here, which you shall you know, see over here. For example, in the seaweed, that might be rich as far as the iodine is concerned. Then it might be oysters, eggs might be there, yogurt, right, cranberries, strawberry, right, navy beans. Obviously the fish will be the you know, which can be the rich source of iodine. Turkey beast and the baked potato and the Himalayan salt, right? These are basically iodine rich food, right? These are basically the iodine rich food, and we can find it in the, you know, we can find it in the soil. And if you talk about the sea, right, important example which you can't forget actually for the sea, it is Japanese seaweed, and for the soil it is onion. And please remember the potatoes, right? I told you the baked potatoes, right, they are rich sources for the iodine. Along with that, I told you the fish, you know, deep sea fishes and the oysters and shrimps and all of these things might be, you know, having, you know, Japanese seafood, it is the rich sources for iodine, right? The other rich source of iodine. Now we are having some indicators for, you know, knowing the iodine deficiency. So we are having some indications for that. So let's talk about those indications, or I will talk about indicators rather. So what are those indicators? So the first one which we shall talk about over here, that is the median urinary iodine excretion. Median urinary iodine excretion, right? If it is less than 100 microgram per liter, then we are saying there is iodine deficiency, right? This is the first indicator which we need to know, right? Then if we are saying that it is less than 100 microgram per liter, right, so that will be saying that it is the iron deficiency. So these indicators are for the iodine deficiency only, right? So these are very important, guys. Please do not underestimate these indicators. They have been already tested in the MCQs. Now next indicator which we shall talk about, that is the neonatal hypothyroidism, right? Neonatal hypothyroidism, that can happen due to you know, low intake of iodine, right? Or the, you know, those endemic areas where has been hit by the poverty areas or low iodine might be there, right, in the diet and all. So neonatal hypothyroidism, here we are talking about, this is the most sensitive indicator for environmental iodine deficiency. So basically it is most sensitive indicator, guys, most sensitive indicator, right, for iodine deficiency, for environmental iodine deficiency, right. Next point which we shall talk about over here, estimation of serum T4 and serum T3. T4 is better as compared to the T3. For serum T4 is more sensitive as compared to T3 over there, right. T3, right. So serum T4 is better as compared to the serum T3. And one more parameter which we should know about over here, that is the quality control of salt is actually performed by rapid testing with the MBI kit. Rapid testing with MBI kits. Okay, so there are the kits which are actually assessing the salt quantity over there, and accordingly they might be knowing that iodine level over there, right. So quality control of salt is actually tested by the MBI kit. Okay, that is the main thing which you need to remember over here, MBI kit. Okay, fine. So once you have talked about the iodine over here and the iodine concentration, right, iodine deficiency, what it can cause, right. Some of the data is present over here which is showing that if you talk about the median urinary excretion, right. So what are the data over here which we shall talk about? Here we are seeing that if it is less than 20, they are saying that if it is less than 20 urinary excretion, right. I told you that this is the data, that if you talk about the urinary excretion, I told you that median urinary excretion, right, if it is less than 100, then we are saying it is iodine deficiency. Then we are saying if it is less than 20, iodine intake is insufficient, and they are saying it is severe iodine deficiency, right. If it is 20 to 49, still the iodine intake is insufficient, and they are saying it is moderate iodine deficiency. 50 to 99 is the still insufficient iodine intake, and it is the mild iodine deficiency. 100 to 199 is the normal. I told you less than 100 will be saying that it is the iodine deficiency, right, urinary excretion. 100 to 129, that is very important, guys. What is the normal range? This will be adequate. This is the optimal. 100 to 199, which you need to remember that this is the normal range. Okay, and if you will be going above than that, then it will be more than adequate. So if you will be going more than that, there is a 200 to 299, that will be more than adequate. And here we will be seeing that the iodine induced hyperthyroidism risk might be there. Okay, then if you talk about more than 300, then it will be showing the excessive iodine intake, and here we shall talk about the adverse health consequences. For example, iodine induced hyperthyroidism might be seen, or autoimmune thyroid problems might be seen over there, right. So once we have talked about the iodine, right, now let's move on to the fluorine. Okay, now let's move on to the fluorine or fluorides. So now let's move on to the fluorine or fluorides. Now fluorides is a double-edged sword. It is a double-edged sword. If we'll be having deficiency of fluoride, that is also a problem. Then you will be seeing the dental caries. If there will be the excess of fluoride, then there is also a problem. It will be showing the dental fluorosis, right. So what we need to do over here, let's talk about that. So basically first question is, what is the daily requirement? Please remember, daily requirement of the fluoride, basically it is 0.5 to 0.8 mg per day, right, 0.5 to 0.8 milligrams per day. Then if you are seeing over here, the deficiency, as I said, it is a double-edged sword, right, double-edged sword, right. Commonly we are using this terminology for this one. Why is it so? Because if the deficiency is happening, then we are seeing the dental caries. If there is deficiency of fluoride, so we are seeing the dental caries over here, right. You are seeing how the teeth are looking over here, right. We are seeing the dental caries, and what could be the problem? The fluorides might be deficient in these cases. Then if they are in excess, then it can cause the dental fluorosis, and you can see over here, right, how the dental fluorosis is there. There is an erosion of the teeth, right. So if the excess fluoride might be seen, then it is causing the dental fluorosis. Okay, so that is very important. It's kind of a double-edged sword, right. If you talk about fluorine, so we have already talked about that. What is the function of fluorine? Basically strengthening the teeth and preventing the cavities. But if the deficiency will be there, the dental caries will be there. If there will be the excess of fluorine, then it might cause the dental fluorosis, right. So food sources may be the fluoridated water, or the toothpaste might be containing some of the fluorine, and you might be seeing some of the advertisement of the toothpaste products. They are claiming that they are having the fluorine in their content. Deficiency, it might cause the teeth decay, obviously. Okay, here I will be writing it will be causing the dental caries. And toxicities, obviously it might cause what? It might cause the toxicities might be causing the dental fluorosis, right? Dental fluorosis. I'm writing the DF, we have already talked about, right? Zinc, if you talk about, guys, zinc is very important. Zinc, if you talk about, it is helping the body to make the protein, right? And it is healing the wound as well. It is affecting the sense of taste and the smell, right? So that is also the thing. And you saw that in the cases of COVID-19, right, we were giving the zinc supplements also along with the vitamin C and the vitamin B complex. And why was it so? Because it is helping us to gain back the effect of taste and the smell thing over here. because we saw that there was anosmia in the cases of COVID-19 first wave, right? So that was happening over there. So that because of that we were giving the zinc also, and with that it was helping us in making the body proteins and helping us in the immunity power, right? Okay, food sources could be the meat, it could be the liver, fish, dairy products, and all of these things can be actually they might be found in the zinc might be found in these kind of food products, right? Deficiencies might be causing the hair loss, it might be causing the decreased growth, stunted growth over there, or rash might be seen on the body surface. Toxicities will be causing the lower copper absorption. Okay guys, once we have talked about that, now we shall talk about the recommended daily allowance from the government of India side for the Indian population, right? So now let's talk about the recommended daily allowance. Recommended daily allowance, that is the RDA. Recommended daily allowance, that is RDA, right? So in this case, if we talk about RDA or the recommended daily allowance, right, we should actually know the energy consumption, and we are actually measuring it in the terms of kilocalories, KCAL, right? We are actually measuring it in the terms of kilocalorie. So if you are seeing over here, we for the men and the women, it is actually different, right? We are seeing that for the sedentary, we are having three kind of categories: sedentary work style, then moderate work style, and the heavy work. So for the sedentary purpose, if you are seeing that for the sedentary one, we are saying body weight. Okay, the reference values have been changed a bit over here, guys. Let me tell you that what are the reference values over here, right? If you talk about the reference values, right, what are the reference values which we should know, right? And then we'll be coming to this particular RDA chart over here, recommended daily allowance, right, for the Indians. So first we should be actually remembering, right, that is what will be the age. Age we are taking from 19 to the 39 years, right? First thing. Second thing which we shall talk about, that is the weight, right? Weight would be the 65 kgs for the male, right? And it will be the 55 kgs for the female. Okay, 55 kgs for the female. Then if you talk about the height, then it will be 95th percentile for both, 95th percentile for both male and female, right? For both male and female. Okay. And they have also talked about the BMI, which we need to take over here, body mass index, which we have already talked about, and they are seeing that 18.5 to 22.9 kg per meter square. I'm talking about the Asian criteria of the BMI, right? Remember, not the WHO one, but the Asian criteria, right? So these are the four reference values which we must know before discussing about the recommended daily allowance for Indians, right? And these has already been asked, right? The question have already been tested from these reference values, right? Okay, so these are very, very important. Now let's come over to this particular table, right? This particular table is quite old, right? There are some changes now according to the RDA, right? According to that criteria. So for the men, we are saying that for the sedentary lifestyle, the weight which I have talked about for the male, that is 65 now. That is 65, no more it is 60. Initially it was 60, but now it is 65. And for the female, it is 55 only. For the female, it is 55, right? So for the sedentary lifestyle, okay, we are saying that it is around 2300. It is around 2300. Okay, in the moderate work, it is around 2700, and for the heavy work, it is around 3490. Okay, approximate value, and they have been tested already, right? So you must know these values, right? So just remember a lump sum number over here. For an example, for the 2320, you should remember the 2300. Then you shall remember the 2700 for the moderate work and 3400 for the heavy work, right? Then if you talk about the the protein over here, initially it was 60, right? We were talking about the protein intake. We used to talk about the protein intake, it is 1 gram per kg, but now it has been changed. The protein consumption now it is 0.83 gram per kg, right? So that is the thing over here. So that's why the values has been changed. So for the male, it should be 54 kg, and for the female, it should be 45 kg if you are taking this particular this weight. We are taking this weight, right? 65 kg for the male and 55 kg for the female. So according to this particular range now, according to the weight, the protein requirement has been decreased a bit. Okay guys, so that's about the protein. Then if you talk about the fat intake, right? Fat intake, it has also been altered, but it is around 25, 30 and 40 if you talk about the sedentary, moderate and the heavy work. And in the females also, you shall remember these values, right? Okay. If you talk about the pregnant female, for the pregnant female, this has been asked multiple times that how many calories they are needing. So it is around plus 350 kilocalories they will be needing. For the lactation woman, it will be plus 600. Okay, they will be consuming over there. So these are very, very important values which you can't forget, right? So once we have talked about that, let's come over value also about the several micronutrients. Over here, you need to remember this particular list, right? that is a new RDA for the men and new RDA for the women, right? Old one is this one. Old one nobody will be asking you now, so you should be remembering the new one over here, right? In the new one we are talking about the calcium. Calcium is same for the for the male and the female, so it is 1000 mg for the male, 1000 mg for the female. If you talk about the iron, it is 19 for the male and 29 for the female, right? Because iron deficiency is more common in the female. 98 to 99% of the Indian females are having the iron deficiency, right? And all the pregnant females are having the iron deficiency, so it is more for the female, obviously. Zinc, if you talk about 17 mg for the males and 13.2 for the females. Then vitamin C is 80 mg for the males and 65 mg for the females. Okay. Vitamin D 600, it is same for the male and female. And vitamin A 1000 microgram for the male and the 840 for the female. Sodium, it is same for male and female, that is the 22,000. So you should remember only the new data, not the old one, right? So you can't, you should forget this particular data. Nobody is actually bothering you about the old one. Now they will be actually asking you the new data according to the RDA 2020.